And we are back. I am at University Cancer Blood Center. I am Kimberly Liebowitz, and this is the second video of the Head and Neck series, and we are once again joined by Dr. Chang. So thank you so much for joining us. In our last video, we dropped off and talking about prevention, and we wanted to pick up that conversation again. So Dr. Chang, what does prevention look like when it comes to head and neck cancer?
You know, prevention is very basic, but very difficult. Basically, you have to live as healthily as possible. So, you know, we know the risk factors for head and neck cancer are going to be drinking and smoking, and actually they have a synergistic effect on head and neck cancer, and that they can increase the incidence even more. Also, things like just routine dental care, just maintaining good oral hygiene, that can also improve or decrease your risk of developing head and neck cancer. But I think the most important thing that can be done is getting the HPV vaccine. We know that the HPV P16 variant is associated with 75% of oropharyngeal cancers. And getting the vaccination can essentially prevent you from developing a HPV-related oropharyngeal cancer.
Thank you for sharing that. I had no idea that that percentage was so high. So say someone has done the preventative measures that you've talked about, and then they are diagnosed with a head and neck cancer, and they're a patient, and they've come to you, they're in the exam room for the very first time. What is your approach as a physician with a patient with head and neck cancer?
Well, you know, it's a team-based approach, so it's not just me. It's the ENT surgeon, it's the radiation oncologist, it is our nutrition team, our speech therapist, our occupational therapist, the patient's family members. We rely on everyone to kind of ensure that we have all hands on deck to make sure that this patient can get the care that they need.
That's amazing. And what is UCBC's philosophy and how you all, yes, you are a team, but it's a holistic approach, right?
Yes, absolutely. You know, health is so much more than your physical health. You know, I tell my patients, you know, how healthy you feel is a combination of how physically healthy you are, but also emotionally healthy and spiritual healthiness. And, you know, we have to recognize that and be able to, you know, address deficiencies, because at the end of the day, what we're trying to do is to try to give every person the best life that they can have.
Well, you heard it straight from Dr. Chang. We're so glad that you have joined us today, and if you were looking for more information about UCBC, please link into their bio and see their website. Thank you.